Right now, we're prepping for a huge battle, but it's not the one you think. It's over who was right about the pandemic if the outcome turns out to be less devastating than predicted. The opinion verse will fall once again into a prison of two ideas. Either the outcome was less calamitous thanks to our hygiene and distancing efforts, or the outcomes were less devastating because the threat was oversold. If you don't believe me, doctors still argue over how they subdued the SARS outbreak from 18 years ago. Some credit public health practices, others say SARS just wasn't as destructive as they thought. The answer to this is probably a mix of both, but that shouldn't matter now because we're still in the thick of it. And it's better to be wrong in your overestimation than in your underestimation, because that meant good news. And maybe the over-concern helped create the better news that allows you to be mocked for the over-concern. Do you follow? I barely do. Still, if we aren't given a light at the end of this tunnel, the public is going to make a light of their own. True, we are patient and unified, but we need to eat, and more important, we need to work. We need a plan, perhaps created by a new bipartisan task force, Dana's idea, to get people back to work in phases. Quarantine the old, get the young and immune back to work, antibody tests and masks galore. And of course, some social distancing remains, which means no mass gatherings. There goes my fan club. But at some point, the younger and the healthy need to get to work. And they just might, whether the government says so or not. Civil disobedience might not come in the shape of a sit-in, but in the form of a thermos of hot coffee and a tool belt. So Jesse, I want people to get back to work for selfish reasons because of my hair. Every day I look more and more like Polly Walnuts. I swear I'm turning into him. Look at that. It's happening right before my eyes.
If I were president, I would open the salons up first, Greg.
Yes, I'm going to start
just to get you a cut.
I'm going to start icing people and burying them out in the what was that place in Jersey? I don't know. That Pine Barrens.
I don't think we should stereotype those types of people, Greg.
He's a soprano.
So here's what I think.
Jesse talks about going to the
top
beach
CEOs of this country, Greg.
Yes.
The top CEOs of this country already say they want to get this thing opened up, but they're afraid to say it publicly.
Right.
Because the U.S. media will chop their heads off, and they'll say that you're Mr. Burns from The Simpsons, right? You're a scoundrel who only cares about dollars instead of death, right? So we're going to open it up, and we're going to keep the social distancing, and you open it up by 4 factors: age, region, and job. Everybody under 45 gets to go back to work. Obviously, you open up small retailers first, then you got to get the salons open quickly for Greg, and then maybe you move to restaurants and social gatherings like concerts way later, right? This is way later. This is at the very end.
Why wait on the restaurants?
If you open up a restaurant, maybe you don't. Listen, you got to open up restaurants soon.
Yes.
Maybe you don't do it right away, but maybe that's phase 2.
Yeah.
And when you open them up, how about you don't go full capacity? You have maybe a table in between each table, like a movie theater, maybe 3 seats in between each section. Because you got to get this thing unplugged. And then obviously New York comes in later than Alaska. We all know that. But Greg, I think everything's changed this relationship we have with the government. They've injected cash directly into our bank accounts. That's going to be very difficult to turn off.
Right.
And then you have the president who's basically ordering companies, produce this now, and this is how much we want of it. That's another tempting thing for future presidents to do. And I don't know. It's $4 trillion from the Federal Reserve. No one has any idea what's going to happen there. So I think it's all uncharted territory.
Katie, one of the other mitigating factors is the drug treatments, which were not factored into the modeling of this outbreak.
Right, because we didn't have enough patients to try the drugs on, right? The doctors to try the drugs on, but now we know that there are some drugs that the doctors are prescribing that are working to keep people out of intensive care and that are actually mitigating the symptoms and allowing them to go home earlier. So that is good. And as the doctors have been saying in these briefings, the data is only as good and the model is what you put in it, and that's what you get out of it. So as we continue to move forward, if we get more of these treatments, we can not have as many issues with the hospitals. But in terms of the economy, I've talked to a couple of non-political people about this who are really angry, and they believe that the shutdown is going to be much worse than the virus itself. And that's a feeling that a lot of people have. So when it comes to your point about people wanting to get back to work and maybe some civil disobedience, I think that you're absolutely correct about that. But on the issue of not overreacting, there's been some, criticism of whether we're doing too much, and if there's not as many deaths as maybe we thought that there would be based on the data. Well, did we overreact? But you can't quantify something that didn't happen. So it's very difficult to figure out whether that was a good decision or not. And people would say when it comes to people's lives, you always want to err on the side of safety, and that's what the administration has done here. Yeah, Juan, I predict, since you and I debate over everything, that for the next year, you and I are going to debate over whether it was the health practices or whether we overstated the threat. Should we start now?
Well, yeah, we can go for it, but I think that, the idea is that if you overstate it, at least it catches people's attention. They say, oh my God, this is serious. It's a threat to my life, to my family. And then hopefully the health practices kick in. I do feel for Jesse because I think lots of times people on the right are saying, oh, we don't like government. Government's not good. Well, right now, government is playing an important role in each and every one of our lives. And I think we have to understand this is a community and we stand together as Americans. I will say this in response to the monologue, Greg. I think that it would be a mistake for us to get out too early. Despite what we might hear from Mr. Burns or Ebenezer Scrooge about get back to work, I think if there's a second wave, if people go back and then they say, oh my God, this thing is not over, now we're experiencing another wave, there'll be a leap in terms of people who feel that they were misled, and therefore there won't be the trust. And that will, again, crater the economy one more time. And that slow down the necessary economic recovery. Because one last point, don't forget, people under 40 get this disease. Not so much children, but a large percentage of people in the hospital right now are under the age of 40. So it's not as if they're impervious just because they're young.
Dana, I come into work and I see a lot of people outside, and I'm wondering, why does social distancing have to be strictly an inside thing when there's when there are people that can socially distance using common sense and be outside on a 65-degree day in the springtime? It makes sense to me to let people out.
And I think Americans do have that kind of common sense. And the only thing I'll say about this is, imagine being in Britain right now, where, believe it or not, people are actually calling the police on their neighbors because their neighbors maybe went out more than one time a day to exercise.
Oh, man.
Honestly.
Yeah.
Everybody use a little common sense. If you're out there exercising by yourself, who cares?
Yeah.